Hey everybody, welcome back to the show. Great to have you here on our Cabral Concept 2160. That is today's episode. If you'd like to follow along with all the links and the research, you can head on over to stevencabral.com/2160. Now, today's topic actually came about as a reader request, or I should say many listeners' requests over time asking for, you have so many shows on helping people to lower high blood sugar and to stabilize normal blood sugar so they can have better mental cognition, better energy, better weight loss, all of those things. What about for people that have low blood sugar? And there's so many people out there that have low blood sugar and don't even know it. Maybe it would be helpful for them as well. And I said, all right, I get it. I understand. Makes total sense to me. Let's do a show on it. So I just want you to know whenever there is a great call for something, and I've gotten many dozens of questions over time on the same topic, if I haven't already covered it, which most likely I have, but if I haven't already covered it, I certainly will. And just keep in mind, I do short shows, like short 3-4 minute answers on each individual question on the weekends too. So everything is searchable at stevencabral.com/podcasts. And literally it's all searchable right there at the search box. So we try to make that as easy as possible, and you can come up with a lot of different keywords to find your specific topic. So today's specific topic would be under low blood sugar or hypoglycemia, and those would be the two main keywords. Okay, so before I get into the show, I just have to give you that medical disclaimer that we are not here to give you any medical advice, any medical treatment plans, or any medical-based cures. Only your licensed medical doctor could possibly do that. So what we are doing here today is providing you with health-based education, and this is in no way intended to treat diabetes, okay? So I just want to share with you some health-based information that I've used in my practice now for 25 years, seeing well over 250,000 people, and I myself dealt with highs and lows in blood sugar. So many of you know my story. You know that I had Addison's disease, autoimmune issues, myalgic encephalomyelitis, POTS, etc. But I also had type 2 diabetes. So the way that you figure out if you have diabetes is typically you have a hemoglobin A1C above 5.7 or above, or you fail a glucose tolerance test, and that's exactly what happened to me. So after 3 hours, my blood sugar had still not come back down. Well, this led to being diagnosed with all these particular issues because with me, Addison's disease and adrenal-based issues is what led to my diabetes. Now, that's the thing is, diabetes, or I should say type 2 diabetes, is typically a result of something else. That's basically it. I wasn't necessarily overweight. I wasn't a typical candidate for type 2 diabetes. I was only 17 years old, pretty healthy overall, meaning like looked healthy in air quotes if you're watching this on video, because that's what the doctors would tell me. But I ended up with type 2 diabetes, and mine was adrenal based. Remember, there's always an underlying root cause. And then, of course, there was an underlying root cause for my adrenal issues. We'll get into that in just a moment. But what I wanted to share with you is that if you're dealing with shakiness, lightheadedness, headaches a couple hours after a meal, unable to concentrate, had difficulty focusing your eyes, low mood, nervous, anxiety, irritability, ups and downs in hunger, overall state of confusion, right? These are all symptoms of low blood sugar. And most people would never know that it's affecting them, or maybe it's only every once in a while. And there's certainly people that are far more prone to it. So for example, the Vata or Vata Pitta body type, far more prone to hypoglycemia, which is low blood sugar. Now, low blood sugar, if you would actually test it right at home, and you can do so with a simple glucometer, you don't even need a continuous glucose monitor, but I will talk about that later in the show, and then I'll link back to previous shows on a CGM. But literally this $20 device that you can do right at home, little finger prick, that's all that it is. You test your blood sugar and you see, are you between 70 and 90 or 95 milligrams per deciliter? And if you are, okay, you're within the healthy range. But if you're not, and you're below a 70, let's say like sometimes I'd be at 48 or 52, like for really low blood sugar. You feel like you're lightheaded, like you're almost going to pass out. That's very low blood sugar. In the 60s, you're definitely going to feel it. A lot of people feel fine walking around in the 60s for blood sugar. I don't necessarily recommend it, especially if you're exercising while fasted, or you're doing a sauna, or you're doing a cold plunge where you might get like a surge of adrenaline or stress hormone. If the sugar is not there, you could definitely pass out. So it's not a safe thing to do, especially in a sauna, in a workout, or in a cold plunge. So do be cognizant of that. You really want to take care of your overall health and not push your biohacking or fasting to too high a level. I also wanted to share with you that when the blood sugar starts to get really low, you may start to feel nauseous. You may start getting heart palpitations. You might see visible shakiness of your hands, and your anxiety might start to go through the roof. So these are all really important. I was working with a longtime client of mine, and unbeknownst to me, he was doing OMAD, which is 1 meal a day dieting, and he's a go type of person. He's you would know him. He's a very well-known, we'll say, celebrity. And I just said, and they basically text me, and I'm being careful with what I say so don't give away any client confidentiality. But they were having issues around this, and they didn't know what it was, and they ended up passing out at some inopportune times. Not that there is an opportune time, unless I guess you're actually in bed. But here's the issue. I had to go through what's going on, what changed, what are the different variables, because the way that I'm able to reduce and deduce what is actually going on is to look at variables. And then as we started to talk more, I said, what are you doing for nutrition? Like, well, I've actually been doing 1 meal a day. And I was shocked, because that is not the plan that I put together for them. And again, like I'm obviously I'm not going to scold them. I'm not that type of person. I said, okay, here's what might be happening. And so we went back, we looked at it, and theirs was actually low blood sugar, low blood pressure, and low heart rate. And so that is a recipe for disaster if those are not balanced. So other ones when it's starting to get bad is going to be blurred vision. So beyond kind of difficulty focusing, I've mentioned the nausea before, kind of losing the blood in the face. You might start to look much more pale, and just overall unsteady, unbalanced. So I just want you to make sure that you're looking out for those. And then, of course, test your blood sugar. Again, it's a $20 glucometer. I'll link it up today. Just go to stephencabral.com/2160. And all my resources are always at stephencabral.com/resources. I've got over 100 resources that I personally use and that I use in my practice and with my family. So what are the main causes then for hypoglycemia or low blood sugar? Because again, we're not diagnosing any disease here. Well, a big one is people drinking alcohol. Believe it or not, alcohol, even though there might be sugar, et cetera, in it, I'm not going to get too deep into whether there's sugar or not in alcohol and how alcohol carbs are different than regular carbs. It doesn't really matter for today's discussion. What does matter is that you'll typically drop into a hypoglycemia, low blood sugar, during the night. And that is because I've said it before, and again, it's not, I do drink alcohol, so it's not that I don't. I don't want to pretend like I'm, this person who abstains from everything. That's not the case. I don't drink alcohol very often. That's for sure. And I drink alcohol like even less outside of like the summer months where I might have it 1 drink a week. And I know that, a lot of people are probably laughing like, oh, that's so outrageous. But that's basically it. Maybe 2, that's it. But for sure, it's typically 1 or 2 drinks maximum per month. And it's always just with friends or out at a nice meal or something like that, where it's more about the atmosphere and community. But anyway, alcohol truly is a poison to the body. A lot of people try to justify it, doctors, experts, et cetera, saying, oh, well, there's this benefit and that benefit. Remember, all the benefits that you would get from alcohol can be gotten from outside of alcohol. Like if you want it from the grapes and the antioxidants, well, you can certainly get that from eating grapes and high antioxidant foods that I've chatted about on a couple previous podcasts. But regardless of how you feel, that's okay. I mean, either way is fine. Again, I'm here to support people. If they want to have a couple drinks a week, that's totally up to them. But I would definitely look at the research I presented to you on drinking alcohol multiple times per week. More than 2 to 3 times a week is certainly going to be detrimental for your overall health, dis-ease, and longevity. So not good for those. But what happens is when your liver is dealing with the alcohol, it's not able to properly process the signals from the pancreas, which is releasing a hormone called glucagon that is meant to is meant to break down glycogen, stored glycogen in the liver. And if it's not getting those signals, if it's not receiving them or open to receiving them because it's dealing with ethanol, the alcohol, then it's not going to be able to bring more sugar back in the bloodstream to keep you stabilized. Now, again, this has been really perverted in the health and fitness industry, like going as low in carbohydrates as possible, going as low in sugar as possible, and that's somehow a good thing. Trust me, it is not. Your brain needs glucose, contrary to the popular keto belief that your brain is going to run totally fine on ketones. Your brain can run on ketones. It does it just fine, but certainly there's a great price to be paid on the nervous system. And again, that's a show I've done another day. So let's go to some other reasons. All right, this is an important one because there are people taking anti-malarial drugs, so medications can also cause low blood sugar. And anti-malarial drugs, believe it or not, are some of those being used right now to treat this current virus. So it's good to know that if you're on these anti-malarials, that you may actually drop in a hypoglycemia. So be aware of the symptoms, right? And I'm going to give you the fix in just a moment. Antibiotics could do this as well. And then same with drugs for pneumonia, okay? Now, I know there's certain antibiotics prescribed for pneumonia, but there are certain drugs as well specific to pneumonia. Another one is anorexia. So there may be people who are eating too little. I guess anorexia, bulimia could be in this part as well. If you're not getting enough calories, certainly that could be one cause. Any liver-based disease or kidney-based disease can certainly cause this. Kidney-based disease is not going to filter out medications as well, food as well, proteins as well. It's going to really throw off your blood overall, and that includes blood sugar. With liver, I already spoke about that before. If your liver is inflamed and it's not receiving signals properly, you're not going to be able to process glucagon to then release more glucose from the liver. And I'll talk just a moment on the adrenals. So as someone that had Addison's disease, and again, I'm a perfectly healthy human being right now, overcame all of my different diagnosed diseases, even though I was told I'd be living with a lifetime of disease. That didn't happen, luckily for me, right? And I guess there was no luck at all. The only luck is reading thousands of books and spending money to go see good doctors, taking all sorts of different protocols. And finally, there is always the fortune of meeting my mentor, Dr. Pete, who really helped me put it all together. And obviously having great parents who, supported me and took me from specialist to specialist, doctor to doctor, et cetera. So, there's a lot of pieces to this, of course. We never do anything completely on our own. But I can tell you that if you listen to doctors, you will be disease ridden for the rest of your life. There's always an underlying root cause. The problem with Addison's disease is that you're not producing enough cortisol, which is a glucocorticoid. Then you're typically running down your blood sugar levels. And then when you eat, you can spike them, and then you're not having proper insulin production. So it's a mess. So you're running highs and lows all day in blood sugar. So sometimes I would be really low in blood sugar, and then sometimes it'd be really high in blood sugar. And my body was not able to regulate that very well. So that is certainly a problem. So what I wanted to share with you now is how to get yourself out of this mess, right? Because there's a short-term fix that registered dietitians are taught to help you with this, or nurses as well. And that's typically to give 15 grams of glucose and to then test your blood sugar 15 minutes later, and then continue to give another 15 grams until it brings up blood sugar. So the problem is, and again, I have a lot of respect for registered dietitians. I mean, probably half of our Equal Life coaches are registered dietitians. And Caitlin, who runs the Integrative Health Practitioner Institute, who's one of my first health coaches, is a registered dietitian, and she's running our entire IHP. And again, I have a lot of respect for registered dietitians, very, very smart individuals. The problem is, and they know it, that their schooling, even though it's a great education, they move you in the wrong direction. I mean, even with registered dietitians, they're telling people to, drink milk, chocolate milk after a workout. These things we know are not healthy. These are not healthy things to do. And for diabetics or other people, they're telling them to keep a candy in their pocket and just kind of eat candy. Again, these things are not fixes, because then they allow people's blood sugar to get out of control. Be like, oh, just have some candy when you start to get low, and it's bad advice. The other thing too is, just have orange juice or juice when you start to feel low. The problem with that is this. Okay, it fixes the hypoglycemia initially, which sometimes you need to do. You need to get quick glucose into your body if you are really dropping low in blood sugar. There's no doubt about that. But again, I'm not here to give medical-based advice. So, when I owned a personal training, body transformation, nutrition studio, we always kept orange juice in the refrigerator. And that's because if anybody dropped too low in blood sugar, which would sometimes happen, set them down on a bench. Once we started to see kind of the blood move out of their face, started to feel lightheaded, sip, not chug, sip on a little bit of orange juice over the next 5 minutes, and all of a sudden their body would come back to life. Now, we wouldn't let them continue their work. I would say that's it for today. And it wouldn't happen very often, but you do want to have those precautions, right? So there is that. But this is it. I mean, listen, you can have a piece of fruit to bring up your blood sugar, but it shouldn't just be that, because the problem is your body's going to use that up and you'll most likely then drop back down, and you drop back down faster if it's candy or it's juice. So I have no problem with saying eat some fruit. Have an apple that's going to be more than 15 grams, but it's not much more. Have a cup of berries, about 15, 20 grams. So all of these are totally fine. They're great. They work. But really what you want to do is to have a meal that's going to have protein, carbohydrates, and a healthy fat, so that you're getting carbs. Yes, that's part of it. But then you're also slowing the release of the carbohydrates with the protein, which kind of increases thermogenic effect, takes a little longer to break down and digest, and the fat as well. And I don't recommend going very high fat with any good carb meal. It's not great for overall health, body transformation, etc. Now, a healthy amount of fat, I'm all for, but having 100 grams of fat at that meal, probably not. So what we do is we make sure in the long term, if you're ever dropping into low blood sugar, no problem. You can have a piece of fruit. I think it's a great idea. But have a meal a half hour later, 20 minutes later. Like, have an actual meal to stabilize blood sugar so that you're just not up and down for the rest of the day. Have a piece of fruit, and then it drops back down. So you don't want to get into that vicious cycle. And in the long run, you probably want to be eating 3 stabilized meals per day. You can still do a 12, 14, or 16-hour fast like we do in our practice. Some people do 12, some do 14, some do 16. The reason why some people do 12 is those people have more of a tendency to low blood sugar. I have a bigger tendency towards low blood sugar in the morning. So when I wear a continuous glucose monitor, blood sugar's stable, looks good all day. Okay, a little bit up after a meal, then it comes back down. We look at it, it's normal overnight, it's normal when I wake up, and then about a half hour to an hour after I wake up, my blood sugar drops into the 60s, sometimes high 50s, low 60s. Interesting. Okay, so what's the best fast for me? And again, I can do this through science. It's about 13 hours to 14 hours maximum. Some days it's a little lower, some days not. But if you see it dropping into the 60s, again, if you're wearing a continuous glucose monitor, you could say, okay, it's now time to eat, because it makes sense. Like, how low in blood sugar do you want to go? Because how much, really, you're asking yourself, do I want to stress out my nervous system? Because if you're dropping that low in blood sugar, it is a neurological stress from the body. There's no doubt about it. Your body needs to then compensate in many ways so that you don't pass out. I mean, this is a real occurrence. The adrenals have to kick in. The thyroid's going to decrease. The pancreas needs to work. The liver needs to work. So nothing is free in this life. That's just not how it works. So what I wanted to share with you is that, again, most people can maintain healthy blood sugar with 3 meals per day. Some people do well with 4 meals a day. Almost no one as an adult needs to do meal, snack, meal, snack, meal. People that are on bodybuilding programs, routines, it's kind of a different story. We're not talking about that here today. But I do have people in my practice that drop in blood sugar even after a good stable meal after about 4 hours or so, 4.5 hours. And so what I do with them is I do a breakfast, I do a lunch. It's a little on the earlier side. It might be around 11:30. So we might do somewhere around like 8, 11:30, and then 3:30 might be a shake, and then dinner's going to be maybe at like 6:30 at the latest. And then those people seem to do fine. Like, they just spread everything out and they seem to do fine even overnight. And they can still get in that 12, 13 plus hour fast because they can stop eating around 6:30 and then they can go until 6:30, 7:30 the next day. So there are different ways of doing this. And again, even those people over time, they can better stabilize their blood sugar and then not have to do that. So like, for example, I used to not be able to stabilize my blood sugar. Now on Mondays, I do 3 out of 4 Mondays a month. I do a 24-hour fast. And if you've never heard my show on weekly fast, monthly fast, quarterly fast, and how you can kind of play with them a little bit. We not play with them, but actually use science to get the most out of autophagy, body transformation, overall health. I will link that up here today. I could go on and on. What I'm going to do is keep that at today and link up a bunch of shows for more information. So head on over to stevencabral.com/2160 for shows on continuous glucose monitors, using a glucometer. I'll add the links there as well. Different types of fasting, 1 day a week, quarterly, etc. I'll link it all up there. So thank you so much. Take care. And of course, please do feel free to share the show with anyone you believe it could serve.